Thank you all for having me again. We are here for part 2 of what confuses us about over-the-counter medications. And you are confused, I am confused, the general public is all confused, because over-the-counter medications are a huge topic. So I'm really happy to be able to talk to you about it. I am a pharmacist, as Maria said. I'm a geriatric specialist, so I took some extra training and try to keep that up about how geriatric people metabolize medications, what doses are appropriate, and those kind of things. I'm also a pharmacotherapy specialist, which means that I've been trained in how to really look at medication regimens as a whole and figure out what might be a problem here and there and what a solution might be. Most importantly, that just means that I like to talk about medications and hear your questions. Today we're going to talk a little bit in the second half of the presentation about herbals and interactions. Previously, the first presentation, we talked about grapefruit juice and some expired medications, about Tylenol, which is acetaminophen, and some of the changes to that labeling and the maximum dose. We're going to start up with herbals, a quick list about that. Now, herbals it's very extensive, so it's going to be quick and dirty. We're going to talk about interactions with drugs and with diseases, and we're going to talk about tapering and sunlight. So let's start with herbal remedies. I have Herbal Remedies-gentler, ? I hear a lot of people say they take herbal remedies because they consider them to be gentler than medications that are either over-the-counter, behind the pharmacy counter, or prescribed by physicians. I do not disagree with the use of herbal medications at all. I definitely take herbals and supplements when I need to. I don't agree that they're gentler, and I don't agree that they are natural. They're based on things that are natural, but so are most prescription medications. Digoxin's an excellent example of that. They're in pill form. Somebody has extracted stuff and processed it and provided a level of it in a pill for you. So how natural is that at this point? Natural things, like I always say, tend to look natural. So it doesn't look like a plant or an herb. It's in a pill form. It may not be as gentle or as natural as you think. Now, on the screen, we have a list of medications, and these are the ones, these herbals, that are most commonly used that have side effects. Now, the thing about them is that they're very effective. But this is the thing about all medications, herbals, anything you put in your body. If it's very effective, it's getting to a lot of places in your body. So what that means is it's also going to have some negative effects. One of the problems I have about the way we borrow in Western culture from Eastern medicine is that we don't take the whole thing. We don't consider the whole thing. It's like a Chinese buffet. We go and we get what we want and we leave the rest. If you go to an Eastern medicine practitioner, they have this very holistic view, and they will help balance you and what you are taking. When we're just taking things off the counter that are supposedly natural, we may throw ourselves out of balance and subject ourselves to interactions and side effects that are negative. So I just want to read through the list really quick. There's guarana, which is a stimulant. Green tea extract, I want to be very clear, this isn't the green tea that you're drinking. It's the pill form that's been very concentrated. It's been extracted. Ginger, and that is crystallized ginger, not so much, but like the extract of ginger. Ginkgo biloba, which a lot of people are taking for memory. Garlic, not the garlic that you're chopping up unless it's a huge amount of it, but the extract. And that's usually used to help protect heart health and those kind of things. Ginseng, saw palmetto, which is usually used if you have prostate issues. St. John's wort, which is used for depression. Dandelion root, which is used for numerous things but acts as a diuretic. Kava kava. Hawthorn, and I just want to say this very specifically, if you're taking anything that has hawthorn in it and digoxin, you need to stop. Don't do that. Very dangerous interactions. Black licorice extract. This isn't like if you just sat down and had some licorice. It's a very specific type of licorice, black licorice extract. Dong Quai. I went to pharmacy school and had a friend who was in medical school at the time who's from Thailand, and she used to always make fun of me. I don't know how to pronounce that. If you know how to pronounce it, you write it and tell me. Feverfew. Echinacea, which seems like it's healthy. Why would echinacea cause you problems? Well, it can. And ephedra. Now the thing with herbals and those kind of things, and I'm going to pull up on my iPad something that someone had asked me during the last presentation, is that you have to worry about what they're doing to get it where it is because nobody's governing it. The FDA does not oversee this unless something has been reported to them where it's gone wrong. So you can take herbal supplements or any kind of supplements, and unless something has happened to someone, the FDA is not going to go and investigate and pull that off the shelf. As we all know, something pretty bad has to happen usually before someone will think of reporting it to the FDA. So you really have to be a steward of your own health here to get in and get those herbal medications in a safe manner. Now, real quick, someone asked me about wolbenzime, or wolbenzyme, I'm guessing is how you pronounce it, N. And this is interesting. It's an herbal or a natural product. It says that it is, and I'll know more about this when I look it up in detail, it says it's the original German formula, and it contains enzymes and to help with pancreas, and it has all sorts of like papaya extract enzymes, those kind of thing. Now, papaya enzyme extract has been around for a while and certainly has some very active properties. So this may be fine, this medication, this supplement. It may not be, but what I wonder is where are they getting this stuff and how are they manufacturing it? What you need to know about that is the USP coming and looking at it? Now, the FDA doesn't, but a supplement manufacturer can volunteer to have the USP, which is the United States Pharmacopoeia, come and test and verify their product. And you can see on the screen there's a little seal that you can look for. And there's things that look just like it that aren't it, so you have to make sure you're looking for the USP. And what happens is the USP will go in there and they will make sure that this supplement contains the ingredients listed on the label in the declared potency and amounts. And that might not seem like a big deal, but let me tell you, if the FDA isn't regulating this, I could manufacture anything I want. I could put 200 milligrams in one batch, 2 milligrams in the next batch, 0 milligrams in the next batch, 15 milligrams in the next batch. And that's totally, totally legal. Not a problem. So this will help ensure that you're getting what it says on the label. It also, and I think this is so important, it makes sure that what you're taking does not contain harmful levels of specified contaminants like heavy metals, lead and mercury. Did you ever think about that? Those could be in there. It's part of manufacturing. You never know where they're manufactured or what's getting in there. Pesticides, bacteria, molds, toxins, or other contaminants. These things can all be in there, and no one's looking for it unless they volunteer to have it checked out. They also ensure that it breaks down and releases into the body within a specified amount of time. When I was in undergraduate school, we did in our nutrition class a little test where we would bake vitamins at a particular temperature. And what would happen is some of them you would see all the binders were just tars. They would tar out all over the cookie sheet. And those were we went and did a correlation, were tested to find out that they weren't absorbable. They would break down. They wouldn't come down, in whole form in your feces at all. They'd break down somewhere in your body, but it wasn't at the right place. It wasn't at the right rate. And so you weren't absorbing anything in these vitamins. And as you know, vitamins can be very expensive. So it's important to know that they're going to break down in the body within a specified amount of time. And it also, this USP seal ensures that it's manufactured with the FDA current standards. It applies those standards when it does the review, making sure things are sanitary and well controlled. That's so important. And there's a website up there on the screen that is about USP verified items, and you can look that up and see how that works. I think that's an excellent website. One of the questions we like to answer, and just so you know, I'm going to get to cough medicines, I swear, is why do you have to take some medications with foods and others on an empty stomach? And it really has to do with the medication. Some medications are absorbed better on an empty stomach because they may bind to food or other medications. Thyroid medications are really notorious for this. Now, you can titrate the dose with your doctor and the levels that you have going on in your body. So there have been studies that show some thyroid medications are fine taken after breakfast, but you really need to work with your doctor to make sure you're at your target place for that. Some work better on an empty stomach. So like Prilosec and some of the other acid reducers work a little better. They're a little more effective if you take the time to take them before a meal, or even with Prilosec before the first meal of the day is often a very good time to take that by about a half an hour to an hour. Now, some things, as you know, can be very harsh on the stomach, so it's better to be buffered with food. These are the NSAIDs most notoriously, and NSAID is an acronym. It stands for non-steroidal anti-inflammatory drug. And this is like your Motrin, your aspirin, your Aleve, those kind of things. And iron supplements are always one that you want to have buffered for most people in your stomach. It really becomes a trade-off, especially with iron, not so much with NSAIDs, but with iron, whether you're looking at the absorption or decreasing your stomach upset. Some iron is better absorbed on an empty stomach, but it causes so much upset that you're not likely to take it, so it's better to take that with food. Now, constipation, no matter what you do with iron, is probably still going to happen. That's not going to be ameliorated with food. Some medications require acid to be better absorbed. They just don't break down as well. And those particular ones need to be given with food or within about an hour after you've just eaten when your stomach acid is higher. And this brings us to a little debate between calcium citrate, usually known as Citracal over the counter, versus calcium carbonate. Citrate is better absorbed and it doesn't really need to be taken with food, but the calcium carbonate usually does. So you just want to try to space that out with your meals. And it's really important with calcium, because of the way it's absorbed in general, to space it out so you're not taking more than 500 or 600 milligrams at a time. If you're having osteoporosis and you're needing to take 1,500 milligrams a day, you probably want to split that up to 3 500 milligram doses with breakfast, lunch, and dinner so that you're getting the most out of that. It's getting absorbed. Calcium is better absorbed with vitamin D in most cases, although there are certain disease states where you have to worry about how much vitamin D you're getting, and you want to talk to your doctor about that. Now, empty stomach doesn't always pertain to just food, by the way. I think people forget about this. So vitamins and minerals plus tea and or coffee and or alcohol can be an issue. There's something called tannins, which may decrease the absorption of thiamine, which is vitamin B1 and other B vitamins, calcium, iron, and zinc, and lots of other vitamins and minerals. So you might want to separate your supplement, your multivitamin, those kind of things from your tea and coffee. And most people tend to take them all together at breakfast with their coffee, but you might want to go ahead and wait till lunch till you're taking those supplements. And likewise, alcohol consumption can really decrease vitamin absorption. It's usually long-term alcohol absorption, long-term alcohol use that affects absorption. Okay, now, in America, we tend to think that bigger, better, faster, more is the way to go. That's just the way to go. So when I tell people, hey, you know what? You're going to have some trouble with absorption. Why don't you do this? What I hear a lot of is, you know what? No, I'm just going to take more, and then that'll be fine, and it'll fix it. Not so much. Too much of anything is a bad thing. Try to remember that. So too much calcium can lead to constipation, excess calcium levels, especially if you have kidney disease. People out there with kidney disease, I need you to listen up for the next few slides. Too much calcium can also decrease your zinc and iron absorption. As an aside, if you're taking a lot of zinc because you might have some skin tears, some skin issues, if you take too much zinc for too long a period of time, it will impede your copper absorption. Copper also helps with wound healing, so it may ultimately defeat your purpose if you're taking too much for too long. Too much vitamin B6 can cause some possible nerve issues. That's a little debatable, but there has been some literature on that. Excess vitamin E can cause gynecomastia, which is man breasts, and most guys don't want that. Another question that's really important but is going to be hard to answer very definitively is, if I've missed a dose of medications, how do I know if I should go ahead and take it later or wait until the next dose? And the answer is that it depends on the medication and the timing. So let's say you're taking scheduled acetaminophen, which is Tylenol, or naproxen, which is Aleve, for arthritis, and you're taking it 3 times a day, breakfast, lunch, and dinner. If you figure this out within about 1 to 2 hours of a dose, you could go ahead and take that dose. And then, just offset your other 2 doses of the day, just a smidge. However, you don't want to go ahead and double up. If you've mixed your breakfast dose, don't take 2 doses at lunch or 2 doses at dinner, because that's going to be too much. It may overload your liver and force it to metabolize things in a pathway that's going to lead to some negative effects. And we talked a bit about Tylenol on the last presentation. You might want to go back and look at that. We talked a little bit about how that pathway can be overwhelmed and some labeling changes. So doubling up isn't a good idea in that case. I think Aleve, which is naproxen, has just a really great way to phrase stuff on their label, so I've copied it here. They tell you do not exceed 2 caplets in any 8 to 12-hour period, but also not to exceed 3 caplets in any 24-hour period. So you can see how you have to pay attention to both frequency and how much within these time frames. And these kind of things are similar for blood pressure medications and anticoagulants, so like your warfarin, or maybe if you're taking low pressor for blood pressure. If you've missed a dose and you're taking it more than once a day, if you're taking it once a day, you can probably go ahead and pick up that dose. But if you're taking it more than once a day, you don't want to double up at your next dose. If within an hour or so, take it and then offset your other doses. But don't double up. Many of the prescription medications have pretty clear guidance, and we're starting to stick those little sticky labels for you guys on there about don't double up this medication. I think those are some of the most valuable labels we stick on there. Over-the-counters, because most items are taken on an as-needed basis, tend to have less guidance, but they're really getting better. If you have any doubt, though, definitely call your pharmacist or your doctor. Now, why do you have to sit up after taking some medications? Some medications, usually these are prescription bisphosphonates for osteoporosis. That's a lot of big words. What that means is if you have some bone issues and you're taking Fosamax or Actonel or Boniva, those kind of things, they're very damaging to the tissues. They don't absorb well, and they interact with other medications. They tend to, leach on and grab other medications. So you have to take these typically on an empty stomach. The problem is that because they don't absorb very well, they can erode. They're very caustic, the esophagus. You can actually get ulceration, little holes in there, and that's not a good thing. So with these, you usually have to drink a full glass of water and sit up for at least 30 minutes, and they usually recommend until the first food of the day. Now, you don't want to rush that and take food with it. You need to wait your 30 minutes before you eat, but you want to make sure you're sitting upright, really upright, or walking around if you can. If you have GERD, which is gastroesophageal reflux disease, or a hiatal hernia, you may want to practice this rule all the time with all medications, especially those NSAIDs, the ibuprofen, the naproxen, the aspirin, those kind of things. Because if you're having a ton of reflux coming up and we're trying to keep things down, the best rule of thumb is to stay in a position where you're actually keeping things down. Gravity works in your body inside as well as it does outside, so you want to make sure that you're not exacerbating what's going on there. Cough medicine. Oh, we've been waiting to get to this part, and it's not just you guys. I've been waiting to get to this part too. OTC cough medicines, so confusing. Can I just say this? The prescription industry has all these rules about how you can't use too many X's and Z's, and new drugs shouldn't come out being named with a Z, and all these things. What they don't seem to have in the OTC industry is some sort of regulation about how many little letters you can put after things. It's very confusing for everyone. So we're going to go through that just a little bit. Medications for cough usually fall into about 3 categories all combined. The first one is expectorants, and expectorant just means, it's coming out. So that one over the counter is guaifenesin. That's the active ingredient in anything that has an expectorant. It's plain Mucinex, no other letters after it, or plain Robitussin. That's what's in these, and these are expectorants. And an expectorant basically just acts to thin out your lung secretions, but you really have to take it with a lot of water, not just when you take it, but all the time when you're taking it in order for that to work. But the goal of this is to help you, if you're coughing up lung stuff, not have to really get past it and have your lungs work super hard to get it out. It should ease that a little bit. There's also cough suppressants, and this is dextromethorphan. It's things that say DM, so your Mucinex DM, your Robitussin DM, or just plain Delsum. Delsum is just Robitussin, just dextromethorphan. That's all it is. And what this is just what it says. It's a suppressant. It reduces the need to cough. Now, there's a lot of debate because you'll hear people saying, well, that is just ridiculous and it can't possibly work, because why would you take an over-the-counter medicine that has something that helps you cough stuff up, an expectorant, and something at the same time that suppresses it? That just must be a total scam. And the way I look at it, and pharmacists will vary on this, but the way I look at it is this. We are not curing anything. All this is doing is helping you get over that little hump when you have a cold or in some cases allergies where you're not feeling good and you're coughing a lot. So it's going to make it easier when you do have stuff to cough up, and it's going to reduce the overall need to cough that frequency. So you're going to feel a little better as you're working toward getting better. Now, your doctor may prescribe an antibiotic or one of those kind of things, or he may tell you that it's viral and that it's going to run its course, but that you can take these in the meantime, and all they're going to do is help symptoms. They don't cure anything. Other things that are in cough medicine, you'll get, a lot of things that say CF, which is cough formula, and that may or may not have what I'm going to talk about next in it, but very often it does. You have stuff that says PE after it. You have things that say cough and cold, severe congestion, those kind of things. And you can actually really apply everything I'm telling you in this slide to allergy medications as well. What this is over-the-counter phenylephrine, or behind-the-counter pseudoephedrine. Pseudoephedrine is the stuff where you have to show your ID and sign your life away and swear that you're not making methamphetamine with it. Phenylephrine is the supposedly gentler, less methamphetamine-related cousin who's available over-the-counter where you don't have to show your ID. What these are vasoconstrictants. They are decongesting. A lot of times you'll see things that say D. That's a decongestant. They contain either phenylephrine or pseudoephedrine. Usually phenylephrine says PE and pseudoephedrine says D, but they're nasal decongestants that contract those blood vessels in your nose to decrease the stuffy nose. And how does that affect cough? Well, you get that post-nasal drip. Have you guys had that where I've got it right now, to be perfectly honest, where you're just thinking, you just feel like you want to cough all the time because things are going down the back of your throat. It's irritating. The problem is that I'm not sure if I said this on this slide or the previous slide, but previous presentation, but I'm going to say it again. No one has developed any kind of medication that is so fabulous and so specified that it only does what you want it to do. All these medications will do things in other parts of your body as well. So these things, this PE, or the D, the pseudoephedrine, are constricting blood vessels in your nose, which may help decrease your cough, but guess what? They're going to go ahead and constrict all those vessels in your heart, in your lungs, in your periphery, with your legs, and those kind of things. So if you have high blood pressure, you really need to be watching this. If you have heart disease, you really need to be watching this. If you have heart arrhythmias, you really need to be watching this. You need to be pretty careful. Especially if your blood pressure or maybe your heart rate are very, very high, or they vary. It's very irregular. You have to be super careful with these. If you're stable, your doctor may tell you for a short period of time it's okay to go ahead and take these. If you have thyroid disease, diabetes, or you have difficulty in urination because you have an enlarged prostate, or maybe you have some other things going on, these medications, especially with the D and the PE in it, can harm you. They can make side effects so unbearable or exacerbate your disease to the point where you have to see a physician. It doesn't happen to everybody, but it certainly is a concern. Let's talk a little bit about nonsteroidal anti-inflammatory drugs. I alluded to those a little bit. They're called the NSAIDs. And this is your naproxen, which is your Aleve, your ibuprofen, which is your Motrin, and, you're going to like this word, acetylsalicylic acid. Doesn't that sound important? What that is aspirin. And the abbreviation for that is ASA. If you take any of these NSAIDs plus some blood thinners, or in combination with each other, let's say you're taking the high dose of aspirin and then you're taking some naproxen for pain, what you're doing is you're possibly increasing your bleeding risk and your stomach ulcer risk. Also, these NSAIDs can counteract some blood pressure medications. These are prescription blood pressure medications, of course, but what they are the medications that end in most cases, in pril, so P-R-I-L, like your lisinopril, those kind of things, benazepril. Most often, because of the way these get together related to the kidneys and your kidney function, they can cause issues where your blood pressure medication may not be as effective as it used to be. And there's some other blood pressure medications as well that may have an issue with this. You need to talk to your doctor and monitor your blood pressure and make sure things are going the way they're supposed to be going. Back to that fancy word, that acetylsalicylic acid, ASA, aspirin. What it does, you know what aspirin is. It eases pain, can decrease fever, and decrease inflammation. There's some confusion, though, because people get it confused with acetaminophen. It's different than acetaminophen. Acetaminophen is not a non-steroidal anti-inflammatory drug. It's just a pain and fever reliever. Acetaminophen is Tylenol, and the abbreviation is APAP. Acetylsalicylic acid is aspirin, and the abbreviation is ASA. Increased publicity right now, I'm sure you've seen the commercials, are around aspirin, using it as a pain reliever. And it's fallen a little behind there. Mainly when you think aspirin these days, you think heart health, but it's actually a really excellent pain reliever. It does have a maximum dose, which is currently 4,000 milligrams per 24 hours. Just like with Tylenol, you can have liver failure if you overdo this. And don't forget about Reye's syndrome. This is the reason it sort of fell out of favor. What that is it's a very dangerous brain inflammation related to people taking aspirin who are less than 20 years old, who have influenza, chickenpox, or fever with a viral infection. So you want to be really careful if someone's visiting you who's under 20 years old about what you're giving them for symptoms if they have influenza, chickenpox, or fever with a viral infection. The problem also with aspirin, it's not a problem, I love aspirin, but it's in more things than you might think. It's in some migraine medications. It's in Alka-Seltzer. It's in some combination migraine medications that you would get prescription. So you really just need to be careful on the labels, just like you would with Tylenol, to make sure you're not overdosing and taking too much. Another thing to know about aspirin is that low-dose aspirin, that's your 81, your heart health, to 162, that's 2 of your heart healths. That dose interacts with ibuprofen in a way that it's not necessarily proven in everybody, but it really could decrease heart protection because it competes. These two things compete for active sites on platelets. Platelets are these blood clotting things that can ultimately lead to clots if you're having a circulatory issue or you're prone to strokes or those kind of things. So know that if you're taking low-dose aspirin, and please do not just start taking low-dose aspirin because you have a history of heart health. It can be dangerous to do that. It can cause more harm than good. You need to talk to your doctor and have them tell you to take low-dose aspirin for heart health. And just know that if you are taking it and you decide to take some ibuprofen, and you're taking it on a regular basis, that your doctor is aware of it. Now, aspirin is more likely, because it's an NSAID, to cause GI, that's your gastrointestinal system here, to cause GI upset, GI bleeding, or interact with medications to cause bleeding complications. So Coumadin, also known as warfarin, if you're on that and you're taking aspirin, especially if you're starting to take it for pain, definitely let your doctor know. Acid reducers are super popular right now, I think because of the way we eat in America. There's a lot of things that, you can get, like a double cheese burger patty with fire sauce, pepper jack cheese, and jalapenos on it. That's going to cause some acid problems, so we are taking a lot of acid reducers. There's 2 different classes of your general acid reducers. One is called an H2 blocker, which are Zantac, Pepcid, or Tagamet. It's interesting on these because I don't think it tells you on the over-the-counter medications to watch the dose if you have kidney issues. But it is true. When I'm doing chart review, I very often am asking doctors, can we reduce this dose because this person has kidney disease? They seem like, oh, they're just completely benign. All they do is reduce acid. But they can build up and there can be side effects because of the receptors that they hit. There's also proton pump inhibitors called PPIs. Most commonly Prilosec, which is also known as omeprazole, or Prevacid, which is known as lansoprazole as well. Interestingly with this, if you take enteric-coated NSAIDs, like naproxen, remember those NSAIDs are naproxen, ibuprofen, those kind of thing. Enteric-coated means that it has a little coating on it, so when it travels through your stomach, it'll go a little farther than your stomach, and then it will release into your body. And they do that so it protects your stomach if you're prone to ulcers, which I'm prone to ulcers, so I usually take enteric-coated things. You have to be careful, though, because if you're changing the acid level in your stomach, what can happen is that coating gets eroded away before it's supposed to, and then the protective effects of it are gone, and you may still not be protecting yourself. So you have to be a little careful in some cases. The supplement ginger may decrease the effect of some acid reducers, which is funny because if you're having a bunch of gastric upset and acids, a lot of times people will take ginger. It's a really excellent anti-nausea, indigestion herbal to take, but it may decrease the effect of these, so it's something to think about. Acid reducers can also decrease, and I think this is super important, the absorption of B12, of iron, of calcium, of synthroid, which is also known as levothyroxine, and is a prescription medication. Let's talk still on this topic, though, specifically about an H2 blocker called Tagamet. It's also known as cimetidine. This is a great acid reducer, but like I said before, if it has great activity in your body, it has the potential for great interaction and great side effects. So Tagamet interacts with numerous other medications. You really need to check with your pharmacist and align everything you're taking to find out if you should be taking Tagamet. What happens is it really raises, sometimes very significantly, the levels of other things you're taking. So green tea, and that's the extract, not the tea, guarana, caffeine, these levels can all be so increased in your body if you are also taking Tagamet. If you're taking prescription medications such as theophylline, which is usually used for asthma, warfarin, which is a blood thinner, phenytoin, which is also known as Dilantin, and it's for seizures, or some antidepressants or antipsychotics, those levels can be much higher, and you'll be prone to those side effects of those medications if you're taking Tagamet along with them. Other acid reducers can be an issue if you have kidney disease. And like I said, if you have kidney disease, these are the slides where you really want to perk up and listen. So laxatives, milk of magnesia, mom, we see that all the time. It's been around forever. It must be okay. If you have kidney disease, it can dangerously increase your magnesium levels if you're taking it too much. So you want to make sure you let your doctor know how much you're taking so that they can adjust for this. There are other laxatives that work similarly that you could take where you're not going to have that magnesium risk. Another thing to think about is your Rolaids or your Tums. And these seem benign, they seem fine, and they increase your calcium levels. If you're a female with risk for osteoporosis, that seems great. But again, if you have kidney disease, you don't want your calcium levels to be too high. They may already be too high, and then you're adding to this. If you're taking stuff for indigestion, such as Mylanta or Gaviscon, this may have aluminum in it, or magnesium, or both. Aluminum in particular, but also magnesium, can be so dangerous at high levels. And this just seems like, oh, well, I have indigestion. I took 4 tablespoons a day for 5 days. If you have kidney issues, especially if you are on dialysis, this can be very dangerous. So let your doctor know. Talk to your pharmacist about that. Antihistamines. Love antihistamines. They're very effective. If they have an effect, though, you're going to be prone for interactions and side effects. So let's say you are out on vacation, you're having a good time, but the allergies are getting to you. So you take an antihistamine, but then you get out on a boat and you're thinking, oh, I feel nauseous, I'm going to take some Dramamine or some Bonine for this motion sickness. Or maybe, I'm not sure if I have allergies or a cold. I'm going to take both cold medicine and an antihistamine for my allergies. Well, the problem is that these are all sister drugs. And in many cases, they're the exact same drugs, or they're the exact same drug with like a little tiny chemical thing just stuck on, just one. So they're going to act the same way. You're going to get duplication of therapy and side effects, meaning that you're going to have confusion, sedation, urinary retention, dry mouth, dizziness. And for the same reasons, you should try not to take these medications with alcohol. So it's really that doubling up of side effect that we have to worry about. Antihistamines may also worsen glaucoma if you have glaucoma. If you have any issues with urinating, they can make that worse. If you have breathing problems, such as emphysema or chronic bronchitis, they can make that worse. And I also want to mention, we have a picture up here of Claritin D. You've got a double whammy here. You've got that Claritin, which is the antihistamine, and just because it's non-sedating doesn't mean it's really, really, really non-sedating. It can still have sedating effects. And then you've got the D, that vasoconstrictant. So again, all of these issues may be doubly impacted if you're taking a combination medication like that. If you're taking a cough medicine and you're taking it with a sleep aid or an anti-anxiety med like Xanax or something like that, some pain medications, tranquilizers, alcohol, some seizure medications. In particular, these cough medicines that contain the DM, that dextromethorphan, that cough suppressant, there can be some significant drug interactions there where you're getting too much sedation, too much central nervous system depression. So it's important to think about that. If you're taking cough medicine and you have glaucoma, again, or difficulty in urination due to an enlarged prostate or for any reason, they can make that worse, especially if you're taking the ones that have those vasoconstrictants in it. Nicotine replacement. I love nicotine replacement. I'm proud of all of you for trying. If you have to keep trying over and over, you are not alone. That is what quitting is about. So good for you, and I'm glad you are taking these. Just be aware, some side effects, some interactions. The level of the nicotine in your blood may be increased with some medications or supplements. Zantac, that over-the-counter acid reducer, you wouldn't think that would be a problem. It actually is. You can get a little higher nicotine level than you may desire. And they've got different patch levels, so you might be able to adjust for that. But that's just something to think about, because those side effects with the nicotine, that jitteriness, the nightmares, you're not alone. Nightmares and vivid weird dreams, very common. Some older migraine medications can be an issue. Usually those are the ergot alkaloids. You'll know if you're taking one of those. Those are pretty old, but they're still around. Dementia medications can cause the level of nicotine to be increased in your blood. And that can cause some confusion that may counteract your dementia medications. It doesn't mean that you shouldn't take your nicotine replacement. It just means you need to be aware of these side effects. And be aware if you are having side effects with the nicotine, specifically the patch, you can take that off a little earlier in the day than right before when you go to bed. Take it off 2-3 hours before you go to bed if you're having these nightmares, and that level will decrease down, usually to the point where you won't have that side effect. Now, with nicotine replacement, it may itself work against other medications. So we just had a slide about how other medications affected it. Well, now this may affect other medications. In particular, some anti-diabetic agents can be an issue. It can also, through side effects or different levels, affect your heart rate or the rhythm of your heart. It can have an effect on blood pressure. It would usually raise that blood pressure. It can have an effect on your stomach as well. You can get some sort of GI side effects there. I love this question. What happens if I take a med with alcohol when it says not to? It depends on the med, but the one I remember most vividly is Flagyl. Flagyl is also called metronidazole. It's most often prescribed lately for gut infections or if you have sort of a female infection. If you take this medication with alcohol, you get something called an antabuse reaction. Antabuse is a medication, actually, that basically was set forth to stop people from abusing alcohol. So anytime they would take alcohol, if they were taking antabuse, they would just vomit uncontrollably. And it was meant to be a negative reinforcement, like, oh, I'm going to vomit. I don't want to take alcohol. The same exact thing is going to happen if you're taking a Flagyl and alcohol. I've had people come back to the pharmacy after I've dispensed this to them and told them, don't drink alcohol with it, and tell me I had to go to the emergency room. I should have listened to you. So if someone tells you absolutely don't drink alcohol with something, really bad things can happen, so be aware of that. Now, on the other side, where you're not vomiting all the time, but maybe you won't wake up the next day, is if you take alcohol with Vicodin, Xanax, Valium, Ativan, antihistamines. Those things can build up, and maybe it won't happen every time, but you never know. It depends on what else you're taking. So what can happen is you can have increased sedation and respiratory depression, increased depression in general. If you're a depressed person and you're really trying to get on track and maybe you're taking some antidepressant medications, alcohol can counteract those and you might feel more depressed. Some people even get to the point, and this is very rare, but where they have hallucinations or delusions if they're taking alcohol with any of their medications. Usually it's confusion, unsteady gait, vision issues, and the sedation, though. That's usually what will happen. If you're taking over-the-counters and alcohol that are like acetaminophen, aspirin, ibuprofen, naproxen, those NSAIDs or the Tylenol, it can lead to toxicity. We had talked a little bit in the last presentation about how you're switching from one pathway to another. This is going to overwhelm that pathway in the body, in the liver, and can lead to some toxicity. It can lead to liver failure, in some cases death. And the thing about liver failure, can I just tell you, and this is on the FDA website if you care to look that up, related to acetaminophen, is that you're not going to know necessarily. It's not like, oh, I drank it and 2 hours later I've got liver failure and I'm totally aware. It may happen 2 or 3 days later if you've had a repeated insult. You might start to feel bad. You might have nausea. You might have bloating. You might have fluid retention. You might have yellowing of the eyes and the skin. So you really have to be on the lookout about not doing things that may lead to that. If you're taking cough medications with dextromethorphan, that cough medicines that have the DM, and alcohol, this can increase sedation. They work together in the brain to increase sedation in many people. Tapering was a question, and I just have to say this is prescription medications most often, although I did mention in the last presentation that I personally, and I think you should too, taper your sleep medications if you're trying to wean off of them and you've been taking them for a while. It's usually after 2 weeks on prednisone or other oral steroids. These are prescriptions. Benzodiazepines should be tapered. That's like your Xanax, Valium, Restoril, Ativan. Antidepressants, most of those have to be tapered. Can I just tell you a little bit about this? I have people who just have such a terrible time getting off of their antidepressants or perhaps switching from one to another. And the problem is that they feel that they're being judged, and so they don't want to have trouble getting off the medication. They feel like there's something wrong with me if I can't get off the medication, and I don't want to talk about it, and I'm just going to suffer in silence. And you shouldn't. Antidepressants can be some of the hardest things to get off of, and it's not because, you're a horrible person with mental illness or anything like that. It's because your body has gotten used to not producing these neurotransmitters in a certain way and at a certain rate. It needs time to get back, and everybody's different. So if you need to take longer to taper your medication, come talk to your doctor and or your pharmacist, and we will work on getting a tapering for that antidepressant that works for you. Long-acting pain medications, if you've had chronic pain and for some reason you don't have chronic pain anymore, perhaps you've had surgery and it's all better, you need to taper these off. The withdrawal can be terrible. Older migraine medications need to be tapered off, definitely. Some blood pressure medications, believe it or not, need to be tapered off. The generic name of these usually ends in OL, OLOL, so metoprolol, those kind of things. Some brand names are Toprol, Lopressor, Zabeta. Those usually need to be tapered because you can get rebound hypertension, meaning that your blood pressure was controlled, and then if you suddenly stop, all those receptors are no longer being blocked, and you might get vasoconstriction and a lot of blood pressure increase. So it's important, and I think pharmacists and doctors, we tend to forget about tapering, to be perfectly honest. We just want to get to a result. So do remind people, should I taper? That's always a good question. Should I taper these medications? The sun. What happens if I forget and go out in the sun when it says not to? I am just bright white, so you can pretty much guess if something tells you or me to not go out in the sun if you've taken it, that I'm going to burn. And the same thing may happen to you. Even people who aren't prone to burn may, because it's settling in the skin, it's causing a reaction in a lot of cases, may burn and have increased sun sensitivity. So really, in those cases, you want to wear a sunscreen, wear a hat, wear some protective clothing. These are usually sulfa drugs, some of those NSAIDs we talked about, and antibiotics. If you're taking diuretics, which are water pills for blood pressure for whatever reason, either over-the-counter or prescription, there are some over-the-counter diuretics, you have the increased risk of dehydration when you're going out in the sun. So that's fall risk, confusion, kidney failure, those kind of things can happen with severe dehydration. And I think a couple presentations ago I told a story about how a woman in a bathroom when I went to go visit Tucson actually fell down because she was taking hydrochlorothiazide and was out in the sun. Tucson's very hot, so these are things to remember. They can happen to anyone, especially if it's a new medication or a change in dose. Now we're going to wrap it up here a little bit with OTC general tips, those over-the-counter general tips, and it also applies to prescriptions. You want to keep and take a medication list to all of your doctors. That includes your herbals, your over-the-counter medications, things you just take occasionally, things you're thinking about taking, and you want to discuss that with your doctor. If you don't take your medications like you're supposed to, and I don't want you to feel bad about that, I just want you to be honest. I don't take some of mine the way I'm supposed to. We all do it. We're all human. We think that we know best. But let's say you're one of these people, and I hear this a lot, I only take my blood pressure medication when I feel I need to. Now, that's not the best thing, but I'm not going to lecture you about it. But what you do need to do is let your pharmacist and your doctor know that, so that if you come to us with problems, we can best troubleshoot it. Because what's going to happen is your doctor may increase the dose and increase the dose and increase the dose because you're not getting where he or she wants you to be. But you're only taking it once in a while, and they don't know that. So then the next time you go to take it once in a while, wham, you've just taken this huge dose, and that can cause falls, and that can cause confusion, and it can be a very serious thing. Try to use one pharmacy whenever possible. I have to say this is so hard with the economy the way it is, and the different prescription plans, and the different kind of drugs, and the prescription requirements for certain things. But if you can, try to use one pharmacy whenever possible. Because we can't add in data in most cases if we don't fill the prescription, and a lot of times over-the-counter things don't end up in there, so it's hard to tell interaction-wise what's going on. Ask a pharmacist about any kind of interactions you might wonder about or any new things you're taking. Again, you want to include those herbals, those over-the-counters, things you take occasionally. If you don't get a good response, I love some pharmacists. I'm a pharmacist. Some pharmacists, you wonder why they're working somewhere where they have to talk to people. So if they're rude to you and you don't get the response that you want, I need you to go to a different pharmacist and ask them, or go to your doctor and ask them. Brown bag events with pharmacy schools. Pharmacy schools have these events where you can just stuff a brown bag or any color bag you want with all the medications you take or anything that's just hanging around your house, and you can talk to them about it. And there's pharmacy students there going through it with you, and there's also preceptors who are pharmacists going through it with you. I can't tell you, we have found so many things at these events. You have no idea. We found really significant interactions. We did some blood pressure monitoring at one, and we found someone who had this heart arrhythmia that they thought was gone. We actually had a doctor on site. Us pharmacists did the monitoring, and we said, oh, this isn't right. Doctor came up. Sure enough, there was an issue. So, please do attend these. We love to have you. You want to question your doctor before, during, and after taking meds. Just always go back to it. Don't think, oh, I've taken it for 50 years, it's fine. That's a huge mistake. Things change. Repeatedly examine your med list if you think you have problems. Just always look at that. If you suspect something is wrong, you need to call your pharmacist and or see your doctor. If something's immediately wrong and you feel terrible, this seems like, oh, duh, but I do have something specific to say about this. You need to call 911. And if you feel like you've had a chemical exposure or some sort of serious medication interaction over the counter or otherwise, or with an herb or anything, call 911 and call poison control. Poison control is going to be a better bet than your regular pharmacist. These people are specially trained. They know what questions to ask to get from point A to point B to figure out what you need to do. They have such extensive and specialized knowledge, it is so important to use them. These are the people I will call. I have some limited poison control knowledge, and so do most pharmacists, but the degree of knowledge the people at the Poison Control Center have is phenomenal. I mean, they will be able to figure out what's going on with you just by asking you questions in most cases. I once had gasoline explode all over my face, and later in the day, I figured, oh, this is a huge issue. I'm suddenly having problems. Well, you know what? They knew the questions to ask. Guess what happened? Had nothing to do with the gasoline. Believe it or not, it was because the canister for my pepper spray, when we all used to carry around pepper spray, had leaked. And it gotten on my hand, and I had rubbed my eye. They were able to figure that out.